In this podcast episode, Dr. Rena Malik, a board-certified urologist, shares her expertise on various aspects of sexual health, intimacy, and the complexities surrounding orgasms. The conversation delves into the nuances of sexual experiences, the importance of communication, and the physiological factors that influence pleasure. Dr. Malik highlights the significant disparity in orgasm rates between men and women, particularly during first-time sexual encounters. While approximately 95% of men achieve orgasm, only about 45% of women do. This discrepancy raises questions about the educational gaps surrounding sexual pleasure, particularly for men who often lack the knowledge to help their partners reach climax. The discussion emphasizes that many women require clitoral stimulation to achieve orgasm, as 85% of women need this type of stimulation, which is often overlooked in traditional sexual encounters. The conversation also touches on the higher orgasm rates among same-sex couples, particularly women, where the rate can soar to 90%. This suggests that the dynamics of communication and understanding in same-sex relationships may contribute to a more fulfilling sexual experience. Dr. Malik argues that the focus should shift from merely achieving orgasm to fostering intimacy and connection, which can lead to a more satisfying sexual experience for both partners. Dr. Malik emphasizes the importance of vulnerability in achieving sexual pleasure. To fully enjoy the experience, individuals must be present in the moment, free from insecurities and distractions. This vulnerability allows partners to explore each other's bodies and desires more freely, enhancing the overall experience. The discussion highlights that intimacy is not solely about physical connection, but also about emotional openness and trust. Being present also means engaging in mindfulness practices that can help individuals focus on their sensations and feelings during sexual encounters. Dr. Malik suggests that practicing mindfulness outside the bedroom can lead to increased sexual desire and satisfaction. By cultivating a deeper connection with oneself, individuals can better communicate their needs and desires to their partners, ultimately leading to a more fulfilling sexual experience. The podcast delves into the significance of pelvic floor health in sexual function. Dr. Malik explains that the pelvic floor is a group of muscles that support various organs, including the bladder, uterus, and rectum. These muscles play a crucial role in sexual arousal and orgasm. Weakness or tension in the pelvic floor can lead to issues such as pain during intercourse, incontinence, and even pelvic organ prolapse. Dr. Malik encourages individuals to seek pelvic floor physical therapy if they experience discomfort or dysfunction. Strengthening these muscles can enhance sexual pleasure and improve overall pelvic health. The conversation underscores the importance of understanding one's body and seeking help when needed, as many people suffer in silence due to a lack of awareness or stigma surrounding pelvic health issues. Effective communication is a recurring theme throughout the podcast. Dr. Malik stresses that discussing sexual preferences, desires, and boundaries is essential for a satisfying sexual experience. Many individuals feel uncomfortable broaching these topics, often due to societal norms or personal insecurities. However, open dialogue can lead to greater intimacy and understanding between partners. The discussion also highlights the importance of asking questions and being curious about a partner's experiences and preferences. By fostering an environment of open communication, partners can better navigate their sexual encounters and ensure that both individuals feel satisfied and fulfilled. Dr. Malik encourages listeners to view these conversations as opportunities for growth and connection rather than sources of anxiety. Dr. Malik addresses the influence of pornography on sexual expectations and experiences. Many individuals, particularly younger people, consume erotic films that often depict unrealistic scenarios and body types. This can lead to performance anxiety and dissatisfaction in real-life sexual encounters. The podcast emphasizes that pornography is a form of entertainment, not a realistic representation of sexual relationships. The conversation also touches on the phenomenon of porn-induced erectile dysfunction, where men may struggle to achieve or maintain an erection due to unrealistic expectations set by the media. Dr. Malik encourages individuals to recognize the difference between fantasy and reality. urging them to focus on genuine connections and communication with their partners rather than comparing themselves to what they see in films. The podcast explores the different types of orgasms and the variability in how individuals experience pleasure. Dr. Malik explains that orgasms can be categorized into various types, including clitoral, vaginal, and cervical orgasms, each offering distinct sensations. Understanding these differences can empower individuals to explore their bodies and communicate their preferences to their partners. Dr. Malik encourages listeners to experiment with different forms of stimulation and to take the time to discover what feels best for them. This exploration can lead to a more fulfilling sexual experience and a deeper understanding of one's body. The conversation highlights the importance of self-discovery in achieving sexual satisfaction and encourages individuals to embrace their unique experiences. The discussion touches on the use of alcohol as a social lubricant in sexual encounters. While some individuals may rely on alcohol to ease anxiety and enhance pleasure, Dr. Malik cautions against overindulgence. Alcohol can impair judgment and lead to misunderstandings, ultimately detracting from the intimacy of the experience. Instead, Dr. Malik advocates for mindfulness practices that can help individuals feel more present and connected during sexual encounters. By fostering a deeper awareness of their bodies and desires, individuals can enhance their sexual experiences without relying on substances. The conversation emphasizes the importance of being in tune with oneself and one's partner to create a more fulfilling sexual connection. Dr. Malik discusses the changes women experience during perimenopause and menopause, including vaginal dryness and hormonal fluctuations. These changes can significantly impact sexual desire and pleasure, leading to discomfort during intercourse. Dr. Malik emphasizes that these symptoms are common and should not be ignored. The podcast highlights various treatment options available for women experiencing menopausal symptoms, including vaginal estrogen therapy and lubricants. Dr. Malik encourages women to seek help from healthcare professionals to address these issues and improve their sexual health. The conversation underscores the importance of proactive care and open communication with healthcare providers to ensure a satisfying sexual experience during this stage of life. Self-exploration is a key theme in the podcast, with Dr. Malik encouraging individuals to take the time to understand their bodies and desires. By engaging in self-exploration, individuals can discover what feels good and communicate their preferences to their partners. This process can lead to greater sexual satisfaction and intimacy. Dr. Malik also emphasizes the importance of using sexual aids, such as vibrators, to enhance pleasure. While some individuals may worry that reliance on toys could hinder their ability to enjoy sex with a partner, Dr. Malik reassures listeners that these tools can be valuable for self-discovery and enhancing sexual experiences. The conversation encourages individuals to embrace their sexuality and explore different avenues for pleasure. The podcast concludes with a discussion on the connection between sexual activity and brain health. Dr. Malik explains that engaging in regular sexual activity can have positive effects on cognitive function and overall well-being. The physiological benefits of sex, including improved blood flow and hormone regulation, contribute to better brain health. Dr. Malik encourages listeners to view sex as a vital aspect of their overall health and well-being. By prioritizing sexual intimacy and communication, individuals can enhance their relationships and improve their quality of life.